Hello, this is Dr. Lorenz, Longevity Health Institute. Good afternoon. I hope this finds you well, educates you even more, and helps you thrive. But let's be smarter, okay? What's my topic today? My topic today is stop the testosterone madness. Now you're going to say, what does that mean? I use testosterone in patients. This is a therapeutic hormone benefit that you hear me boast about, that I have multiple videos on, that hopefully if you subscribe, which you should be, and you follow me, because you'll get the benefits of knowledge, right? And you can share and use. And if you need us, we're here, Longevity Health Institute, me and my practitioners. But you can also not fall into these testosterone traps, the social media, Instagram posts, get your testosterone online, and use it inappropriately. That is causing a lot. And I'm telling you, because I see it here, and I dealt with something today related to it, so that's why it's fresh in my mind, is that the testosterone madness, the hormone madness out there is a little bit nutty, because we're looking for an effect. We're looking for something, because things got to be better, right? I got to have more energy. I got to be better, be stronger, got to look better, got to be faster, got to compete with the world, and etc. I got to be younger, okay? But let's take a time out here, okay? And why I call it testosterone madness is because, first of all, it's a anabolic hormone that is controlled. So technically, how in the ethic, being ethical and being, well and being appropriate for you, I think is really getting breached, because you can get this stuff online and people do a lot of crazy stuff out there. And they're getting inappropriate, unsupervised, excessive treatments, and they're getting a result, but it's not done right, and there's a lot of side effects. So I want to cover that, okay? So let me start with the pros and the benefits, which you've heard me say before, so I'm not going backwards on anything, okay? But when you realistically measure hormones, the benefits of hormones for the body, they're signaling molecules. There's nothing strong in your body in all hormones, but they need to be balanced, and they need to be done appropriately, optimally, and appreciated for what they are. But you'd sure as hell damn well be seeing a physician or a PA or a nurse practitioner, and no one else, in my opinion, no one else. And the reason is because you have to understand the physiology and the science and how they work on the body, because there's a lot of pros, there's a lot of upside, but there's some cons, and you have to understand the balance of hormones. Hormones are all about balance, and that's when you get the wonderfulness of hormones, is when they're kept in balance and they work in your body that way. Now, specifically, we're going to focus on testosterone and what the benefits are, but it is a hormone of stimulus for the mitochondria and for the muscle. So of course you're going to get some muscle benefits, some muscle gains, some anti-inflammation, some strengths, some stamina, okay? You're going to get benefits, and you can get benefits cognitively. The frontal lobe is fed by, and the prefrontal cortex is fed by testosterone, so it can open up your brain and help you think a little bit clearer, a little bit better. In fact, there's studies on brain volume and how that's sustained by testosterone. You're going to get, I think I mentioned this, but less inflammation in the body. So joint inflammation and aches and pains and stiffness should be alleviated if it's needed, if testosterone is needed. You'll get sexual benefits, improve libido, okay, enhancement of relationship, improved erections, improved intimacy, which is very important in a healthy relationship and having quality life and love, and studies have shown that, okay? There is immune benefits. You don't hear about that, but there is immune benefits to testosterone, okay? But let me talk about the madness that is out there. Is people are seeking these things and think that one size should fit all, and if some good, more is better. But then what happens is you get into all the side effects, okay? Now, we want physiologic dosing, so when you're tested and you have somebody looking at your labs, that's hopefully a functionally trained, wellness-minded, preventative physician or practitioner. They're looking at these ranges, which are important. And yes, you don't want to be down in the pits, but you don't need to be super physiologic. This is where the side effects are. You need to be in the upper quartile and optimal if you have a symptom that's related, because we all have hormone receptor activity that is unique to us. So unique to Dr. Lorenz, unique to X out there, unique to another 50-year-old patient, male, what have you. But we're all unique in that way. So that means that our receptors have to be filled with the hormone, but the number is not finite in the sense of, oh, I have a testosterone level that is 400 or 350. Oh, I need testosterone because I'm going to get energy and muscle and strength and stamina and a better brain function and all that, and better sex. You can't look at it that way. You have to look at this, your symptoms, but you have to look at this range, and where, again, a qualified physician with experience will be able to direct you this way. But why am I saying the madness? Because you have to look at the whole picture. Why does somebody have low testosterone? Well, some of it's aging. Again, our testosterone gets depleted as we age. It's an epidemic. That's a whole nother story. Why is that happening? Decreased sleep, stress, diet. None of us are, well, not myself and my patients that I guide, but are exercising or moving. We're sitting behind a computer or a screen. We're not lifting weights that make testosterone, and there is hormone endocrine disruptors in our food. So that's why I say it's an epidemic, just like infertility is becoming an epidemic in our country. I mean, literally the rates and percentage of us infertility-wise and male hormone decline, testosterone specifically, that's our topic today, is astronomical to decades ago, okay? When you talk about age-matched men. So it's a real thing, okay? But you have to look at why. Why is somebody's testosterone low? So whether you're 30, 40, 50, 60, 70, okay, there's reasons for this, and a skilled practitioner will take all of this into account. I have a gentleman today that I reviewed his labs. He's been a patient for about 4 years. We do not use testosterone in him. He came in with a testosterone total of 250 when he came to me 4 years ago. Of course, he was fatigued. Of course, he had more inflammation. He struggled with gaining muscle and losing fat. Of course, he had these issues. What was his real issue? What was the cause? Highly stressed, an adrenal issue due to the stress, not good sleep and good recovery, overtraining. He was a very driven businessman, salesman, but also exercising excessively without enough recovery. Okay, and you need recovery to make hormones. So with all these depletions in him and not being balanced, his testosterone level was literally, he was 70. We did not use testosterone in him. We treated it for what the issue was: getting him better sleep, helping him with sleep, coaching him on stress reduction, actually coaching him on training and staying exercising and fit, but reducing that and improving recovery. And what else we do? We worked on him with the right supplements, the right diet, the right amino acid and protein, so that he can build testosterone and repair and recover. His levels are over 500 a day, feels amazing, had no complaints. We were just reviewing labs and some of his genetic sequencing. And but what's better are all those other things. And that's common. So sleep's really common. Stress are common causes of dysfunction of testosterone. The other thing is if you're eating a PAD diet and a lot of hormone, endocrine disruptors, processed meats, non-organic and free-range meats and animal products, okay, high fats, okay, trans fats, actually a lot of soy products. Okay, soy, it has estrogenic effects. So estrogen goes up, testosterone comes down. They compete for the same receptor. These are very, very important. Other thing is this: if you're fat, sorry to say it, but if you're fat, you very likely, potentially, you should have your testosterone looked at, because at least to ratio, you probably have higher estrogens and less testosterone, okay? But you have to appreciate why, again, that testosterone's low. Most common reasons I see here is lack of good quality sleep. And again, not just the time in bed, but the actually deep sleep, good quality sleep. Also the stress, the adrenal levels, okay? Adrenals account for about 30%, if not more, of your testosterone production. It is a little bit based on age, but those are really true things. So again, stop the madness, because to correct the testosterone, you have to understand why testosterone is low. And so you don't just treat somebody, and we have methods to up somebody's testosterone pharmaceutically without testosterone if needed. But the other thing is this. What are the side effects? Well, you treat somebody with low testosterone without treating the underlying root cause, you're very likely to get polycythemia. Polycythemia is a production, an overproduction of your hemoglobin and hematocrit because of a stress effect that happens on your bone marrow, okay, essentially with testosterone, okay, exogenous use, meaning you're giving yourself testosterone. That can happen. That's one of the side effects. It's not very common, but it can happen, especially if your levels and you're being given too much. And the other thing is, though, is that if you give that to a person that has sleep apnea, even sometimes I see mild to moderate sleep apnea, which is very common in America because we're overweight and, again, poor sleep, and then we get hypoxic at night, and you produce, one of the side effects of that is that stressor is your body compensates by making more hemoglobin hematocrit to help, essentially, it doesn't work this way, but it helps to try to compensate to carry oxygen in your body because you're hypoxic. It's trying to compensate for that deficiency. Problem is, you raise your hemoglobin hematocrit, then you give somebody testosterone, that's a side effect. You're causing this polycythemia, which is thickened blood. Making it sound easy, your blood's thick. It's like sludge in your body. What are your risks? Heart attack, stroke, blood clots, microvascular changes in your brain, even so slow issues with blood circulation in the brain, so dementia, and hypertension is very common. And fatigue, you just don't feel good. Your blood's not moving, you're not oxygenating tissue, okay? The only way you're gonna ever feel good anytime, number one, you gotta have good oxygen, good blood flow. I mean, that's basics, okay? Anything that disrupts that is gonna cause fatigue, okay? So treating the underlying cause and not bypassing it just to, oh, it's in vogue to get testosterone and Instagram tells me to, okay? Social media tells me to. This guy's post tells me to, and he's really cool, and he's got 1 million followers. You're going down a rabbit hole that is not going to be good for you, I promise you, okay? So there are risks there, and you've got to look at that. You want to, number one, my advice is understand why you have low testosterone. It could be that you're 70 years old, could be, but you want to, at any age, appreciate the sleep, the stress, the nutrition, the weight, the exercise. All these things matter, and make sure we're first in medicine, because this is a medical treatment. This is not something to take lightly. It's to first do no harm, okay? I often see patients come for our help here at Longevity Health Institute because they've been inappropriately treated with testosterone, dosed wrong, okay, or dosed to a point and didn't look at the whole picture of their health, and things were missed, okay? So they got some benefits, but some side effects, and it didn't work as well as they thought, and all that, because it's not all just about that one hormone, okay? Although it is very important. So the message here is stop the madness if you're out there and thinking that that's going to fix everything, but see a qualified doctor that is trained functionally, preventatively, through wellness with hormone experience. They should have significant years of hormone experience, and not just, oh, I'm a doctor, I'm a practitioner, I can do this for you, or you're ordering it online, because you're going to get yourself in trouble and you're going to regret it. But also appreciate the benefits it can give you, because let me tell you, it can give you wonderful benefits if it's done right. This is Dr. Lorenz. As always, a pleasure. Please subscribe, follow me, share, okay? I promise you I'm going to lead you to health and wellness with passion. Appreciate you. Take care. Have a great day.